Hi, my name is Carolyn Harris. I've worked at the Trust for 30 years, over 30 years now. I originally trained as a staff nurse at the organisation, and then I moved in various departments, working in 18 years in the theatre recovery department. In 2014 I moved towards into learning and development, which I've worked ever since, and I'm also a health ambassador. The initiative shows what it's like to actually work in the NHS and to see what these different roles are actually like in a real working environment, so people can go and take experiences of what happens in their areas, and they can share those with the students in the schools. And also they can talk about things like career journeys, how they actually got into those areas, what training they needed, what qualifications, and also how their sort of career journey has moved them through the organisation. So that's one of the things that's very good with the Health Ambassador initiative, is that you can actually share this information with students and sort of get them interested in some of the careers that they might not realise actually exist, or they might not have considered them in the past, so they can investigate more and see whether these are things that they're interested in developing careers in. One of the benefits of the Health Ambassador initiative is that it can ensure that the future workforce is interested in the different roles within the organisation, and that the community is interested in their organisation, their trust, and if they want to get into healthcare, they can see what the different roles are within that organisation. And I think one of the benefits is that they can see that healthcare has got lots of different job roles and different specialities that they can actually aspire to join in and getting careers in those areas in future. I think that's really important. And to see that it's not just doctors and nurses, there's a lot of different areas clinically and also non-clinically that people can have careers in, everything from healthcare sciences to business admin, to finance, to training. There's lots of different things, pharmacy, and then clinical roles. There's lots and lots of different clinical roles, nursing, allied health, pharmacy, lots of different areas that you can actually work in that can be beneficial to your local community and your organisation, but you can have lots of rewarding careers following these paths. So what do the health ambassadors at Sherwood Forest do? Well, we've done lots of different initiatives with local schools and colleges. We've also attended careers fairs for job recruitment for unemployed people in the community. One of the main things that we have been involved in is actually attending school careers fairs, where we have a stall set up. We're there to answer questions on the different careers that people can have in the NHS and healthcare, and a lot of times they're children and students with their parents, they can get lots of information from us. So we have lots of career booklets, career information, links and signposting to different websites, what training you might need for particular posts and roles, and also just to talk to people that actually work in the health service, to sort of iron out a few myths about what working in the NHS is really like on a day-to-day basis. So that can be really, really useful for engaging people in the local community, especially school children who are looking to develop their careers in different areas. And it's to give them the ideas and sort of make them curious about the different sort of roles that are available in the NHS and healthcare. We also get involved in mock interviews, so we go to schools or colleges and we actually take part in a formal interview situation, so the students prepare for their interview as they would for any job. They dress suitable for the interview, and they actually sit and we interview them. Sometimes this is individually, sometimes this is in a group, and it gives them that real experience of what it's like in an interview situation. And then after we've finished the interview, we can give them positive and constructive feedback. We can give them hints and tips on things like developing confidence within interview situations. So we can give them a lot of input, and it just gives them that taster of how it feels in a real interview situation, and hopefully will help them in their careers in future. We also do presentations with different subjects. So for example, we've done presentations about patients' journeys. We have an example of a typical patient's journey. He's a 16-year-old who's injured his leg playing football, and it shows the journey that he goes through from the calling of the ambulance and the paramedic side of things, right through to coming to A&E, going to X-ray, having his X-ray done, having blood specimens taken, going to the theatre, having an operation, going back to the ward and the care he gets there, and also things like maybe you need some physiotherapy, so we talk about those roles as well, and the pharmacy, giving him prescription medicine to take home, and then his sort of recovery and what sort of help he'll need then. And it's also important to talk about the other roles that will affect him while he's in the hospital, but he may not see these people, and they're all really busy doing their own work, but he might not actually come across them. So there's lots of admin staff that will have a big part in his care. There's also things like the estates and facilities that will provide, for example, the bedding, the sheets, the things like that he'll need during his stay in hospital, and to just maintain the buildings and make sure that he's safe in there. So there's a lot of different roles that he might not see during his journey, but we can elaborate on those and show the students when we do these presentations that there's a lot of different careers within the NHS and how they actually affect people. We also do practical activities within schools, and these can also be tailor-made to what that school in particular needs. We've done things in the past like hand hygiene, practical assessments, so we've gone through the theory of how our hand hygiene is very important and the ways to do it properly. And we've also done practical sort of hands-on activities where they can come and actually wash their hands and use the glow and tell and see what their technique is and actually share that information that way. And it's quite good to support the schools if they're doing things like in biology, they're doing about different infections, or they're doing about infection control, for example. And these activities can actually help to support the schools within their curriculums. We've also done other activities within schools, for example, drug dispensing activities where we've gone into the schools and have actually done a mock drug dispensing, so the children can actually get a hands-on feeling of what it's like to actually dispense mock medication. And we've also done things like patient observations and actually basic care for patients, for example, safe moving and handling of patients. And we can bespoke these to what the school needs. We've recently tried to examine what tech we can use within schools to make things a bit more interactive. We recently purchased an interactive t-shirt, which when you get a device with an app on it and actually look through the device at the t-shirt, and you can get an idea of the position and the actual structure and the ways that these organs work in the body, and that's going to be really, really useful because it's very interactive, and children and students like interactive activities, so that's going to be really, really beneficial when we get that out to schools. Benefits to our organisation is it shows that Sherwood Forest is a good employer and it's a local employer, and it gets people interested in what the actual organisation is doing about the different careers and how to attract people into those different roles. It also protects the trust in future, keeping people interested in developing careers in healthcare, so that if you've got a time where you've got staff who are retiring, for example, or moving into different roles, you've got people interested to be able to fit into those roles and have very worthwhile careers. And we also provide a link to students or people that maybe didn't think that the healthcare environment was what they wanted to work in, and we can open their eyes to see that there's a lot of different careers within healthcare, and it's not just doctors and nurses, and it's not just clinical as well. There's a lot of other things they can do in their careers and have really, really fulfilling careers within the NHS, but it doesn't have to be clinical. The Health Ambassador Initiative can also develop our current staff if they're interested in training or interested in getting involved with promoting their own departments or specialities. Then it can give them a real confidence in, for example, presenting on a subject or getting involved in a subject, so it can be really beneficial to the staff in the organisation as well.